Hi, this is part 2 of chapter 2, and the first thing we're going to talk about is sudden infant death syndrome. This is something that we still don't know quite all the reasons why this happens, but it tends to happen within the first year of life. The main concern we have for child care is that we always put the babies to sleep on their back. That's the sudden infant death syndrome, a back to sleep program. Always put them on the back. Do not ever put them on their stomachs to sleep. Sometimes you may have a child that has a note from the doctor saying they need to be sleeping on their side, and we use little triangles to prop them up on their sides, or they sleep while being held, but never ever ever put them on their stomachs. It has been proven that the back to sleep program does save lives when it comes to SIDS. Toilet training. Always a fun topic to speak about when working with children. Usually kids are able to be potty trained when they reach the age of 18 months to 2 years of age. There is a magical window around 18 months of age where some children are able to be potty trained. Some children potty trained before then, some after then. But you cannot make a child be potty trained. They have to be ready. They have to be able to tell you that they can go to the bathroom. They have to be able to hold it and release it. They need to be able to pull their clothes off. They usually can't put them back on, but they can pull them off. But the biggest thing is being able to control those sphincter muscles to be able to use the restroom. If those muscles are not developed enough, they are not going to be able to control that behavior. And sometimes a child cannot have any control, and sometimes a child has to have surgery on those muscles. Usually, if you're looking at 4, 5, 6 years of age, they still cannot control those muscles. That's when they look at that. But usually with our younger children, the younger the children, you can start getting them to be involved in potty training by using children's books, putting them on the potty in the classroom. And we're talking more about this later in class. There's lots of different ways we can help with potty training. Cognitive development. We talked about Piaget earlier, and he has 4 different stages of cognitive development. We have the sensory motor stage, where everything the child is involved in is around their 5 senses. They pick up everything off the floor. They find everything they can find. They put everything in their mouth. That's why the room has to be as clean as possible at all times. This is the stage we're focusing on the most on the birth to 2 years of age with our infants and our toddlers in this class. You're going to be hearing more about this as we go through the class. In the chapter, it talks about accommodation and assimilation and equilibrium. I want you to pay close attention to those terms in this chapter. Now, we also move on to, while we are in the sensory motor stage, there's sub-stages under that. Now, I'm not going to be very picky about the sub-stages as long as you know what the sensory motor stage is. Learn it, memorize it. You will have it in every class in the early childhood program here at UACCB. Now, we're moving on to speak about play. And this is where Vygotsky comes in. Vygotsky, remember, he's our social culturalist theorist, and he's the one that studied how children play with each other. I spoke a little bit earlier about how children go through different stages of development where they're working with others, called the zone of proximal development, where that's the difference about what they can do on their own as to compared with us helping them in scaffolding. Be aware of those terms in this chapter and study those. This is also, in the social cultural, is when we have pretend play or make-believe play start showing up between 18 months to 2 years of age for the first time. That's when the babies start pretending like they're holding a baby, they're patting the baby, they may pretend like they're feeding a baby, but they're starting to watch others around them and mimic the behaviors of others in their classrooms or their parents. Language development is moving very, very, very fast at this stage. It goes from utterances to 1 word to 2 word to 3 word to sentences, and some language I want you to be able to be aware of in this chapter is phonology, semantics, syntax, and pragmatics. Know what those terms are. Also, telegraphic speech and jargon and babbling. Know what that is. I'm going a little faster because I don't want the video to be too long. Children with special needs. By law, we have to work with kids with special needs. There's lots of goals and objectives that a child will have. If we have an ISFP on a child individual family service plan, that means that is what we have to do with that child. We have no other recourse than to do that. It is the law. You have to follow those to the T and do exactly what those special education teachers tell you need to do in the classroom. There's lots of different types of children that we may have in special education services in our classroom. You may have children that have large disabilities, very involved disabilities. You may have children who just have a very small disability. You may have children that are in your class for speech therapy. You may have children that have physical disabilities, cognitive disabilities, and you may have medical disabilities in your class. But you have to treat all of these children with respect and interact with them and follow their IEPs as close as you can. That is Chapter 2. If you have questions, I've also put the PowerPoint presentations under Week 2, under Chapter 1 and Chapter 2, to help you along with these chapters. So, good luck, and I will see you next week.